the biggest thing is if you're afraid of it, I feel like it's beneficial to come in and at least get tested. It's not going to hurt you to at least get your labs run and just see. I mean, you may not realize that's something that's going on in your body or not going on in your body. And there are so many different options, but for me, the pellets are top. I mean, I've tried topical, I've tried other things that just did not work. And I feel like, because you keep the pellets in your system, you're going to absorb it better. And I'll just say, don't be afraid of it. If it's not for you, you don't have to do it again.
Welcome to Hormone Heroes, where I share testimonials from real people who have experienced bioidentical hormone therapy. Men and women share the symptoms they have experienced and the difference proper hormone replacement has made. I'm your host, Dr. Kelly Hopkins, and I have been in the functional medicine space for over 30 years, with a focus on hormones for 20 years. Please keep in mind this podcast is for educational and entertainment purposes only. Please consult with your physician or practitioner for medical advice. Let's get started with today's guest. Hi, and welcome to the podcast. Today we have Debbie Shirey. She is a family nurse practitioner, and she's also has a very important role as the clinical associate professor of nursing at Baylor University. And she is also a certified health and wellness coach. Welcome, Debbie.
Thank you. I'm glad to be here.
So just give us a little bit of your background and walk us a little bit through your life up until this point.
Yes, I started out as a broadcast journalist back in the early 80s, and I had a premature baby in 1986, a 26-week baby, and he was in NICU for at least 4 months and then in and out of hospitals for the first year. So while he was in NICU, his primary nurse said, "Have you ever thought about going to nursing school?" And I said, "Oh gosh, no, I'm not smart enough to do that. All my friends have to read a lot of heavy books, and I'm not into that." But long story short, I went to nursing school, and once I got in there, I loved it. And I just kept wanting to advance my education. And I went all the way through and completed my doctorate in 2013. And so I've been teaching in nursing programs for about 25 years now. And It's all very rewarding. In addition to working as a family nurse practitioner, it's the best of both worlds for me.
So as a nurse, what sort of clinical work did you do? Or did you go straight to teaching?
Well, I did a little bit of both, but I worked in urgent care, and I also did community health work. I worked for, I've done a lot of volunteer work with homeless shelters and domestic violence centers while I was in Dallas. But my work home has primarily been urgent care because I like procedures and I like kind of the, quick fixes, and it makes me have to think fast. So
yeah,
I kind of like that chaos. I was an emergency room nurse, so it kind of fit me to a T.
Uh-huh. And now your focus is you've kind of gone a different direction with the health and wellness coaching. Tell us a little bit about that.
Yeah, I realized the longer I've been in this, in nursing, the more things that I realized that we don't learn in nursing school. And even though we know how to interview patients and we know how to talk to, patients and use therapeutic communication and all that kind of stuff, we don't learn motivational interviewing, and we also don't learn to embrace the wellness aspect. And when you're looking at the person as a whole, there's so much that goes along with that. And that includes nutrition. And we get one nutrition course in nursing. And I think that we are really underserved in that area because nutrition is the foundation for everything.
It truly is.
To really sit down and tell our patients and our clients about good nutrition, not just about diets and weight loss and that, but about why processed and ultra processed foods can be so harmful and cause inflammation and heart problems and diabetes. And so I felt like this was a good role for me to kind of switch. And as I decide to transition to a retirement, I'm not going to retire completely. I would like to work with clients one-on-one and help them develop goals and strategies for making better choices.
That's fantastic. So I'm sure with all this new information that the United States especially is being made aware with our new administration and things, seed oils are bad. You mentioned the processed foods, the food dyes, a lot of things that we are allowed to eat and buy in the United States are not allowed in other countries without warning labels on them. So your expertise is very much needed. So tell us a little bit about your own hormone journey, and then I want to talk a little bit more about your future with your coaching. So when did you start to notice symptoms of hormone deficiency?
I swear it started on my 42nd birthday. I had a hysterectomy when I was 30 years old after my second child was born. And after that,
why did you have to have a hysterectomy?
I had, from the traumatic birth with my first child, I did have a traumatic birth with him. I had placenta previa. I had eclampsia. I was actually not supposed to have a second child. They had told me not to have any more kids. And, that's what the smart nurse does. She goes and gets pregnant for the second one 5 years later. But I had her, she was a little bit early. I still had preeclampsia with her, a lot of health complications, but I also had tremendous scarring of my uterus, and I just could not hang in there. And he said, well, we can do two things. I thought I was hemorrhaging to death. He said, we can either put you on birth control pills or we can take it out. And I said, no, I want to just take it out. So I opted for that. I did keep my ovaries, however. But as you may know, when you have a hysterectomy, even if it's only the uterus, the ovaries tend to die out earlier. So about 42 years old, I had moved to Arlington. I was teaching at the University of Texas at Arlington. I woke up in the middle of the night and I was having the worst sweat attack I've ever had in my life. And I was completely soaking wet, sweating in places I didn't know you had sweat glands. Like, what is this? And it was like a tsunami. And I realized then, because my hair was wet, everything, I said, this must be a hot flash. This is what my gynecologist was telling me about. And so I went and started, doing over-the-counter stuff. I did some compounding things. I tried many things. I got on Premarin, and those things worked a little bit, but nothing really fixed it. So I just kind of lived with it and suffered with it for, about nearly 20 years. Because I didn't realize that there were so many options available.
Uh-huh. And I noticed in your notes that you'd said you'd tried Premarin in the beginning. And as we've gotten more and more education about that, it's a little bit difficult to want to use those equine estrogens, and and then you add the synthetic progestin to the Premarin, and that becomes Prempro, and that takes us over to the WHI study that showed so many women were getting more breast cancer, blood clots, all that good stuff. So, but lots of people have tried Premarin and it works for some, but I was glad to see that you weren't on that currently.
Yeah, and I think I had a little bit of an advantage being a practitioner and having prescribed, because I understood what the consequences were of long-term Premarin use. And when I turned 50, I knew it was time to come off of it. Even though I didn't smoke or anything like that, I thought, I don't want to have a blood clot. And I knew that I was more prone for that if I continued to take it.
Yeah. So you had mentioned hot flashes, central body weight gain. Do you mean thickness in the middle or?
Right around my gut. Yep. It's, and it's like from the waist down, everything started thickening, and it was hard to lose. That was a real challenge, trying to get that weight off. And then I noticed being fatigued. Well, I was also diagnosed with hypothyroidism somewhere along the way. But, it was just that. You notice you're having things like vaginal dryness and the thinning of the skin and in the genital region, and zero libido. There, all those things that go away, and painful intercourse, and nobody wants to live with that.
Right?
Not fair to your partner, for sure. So,
yeah,
it was it was pretty terrible.
So, tell me what is your current hormone regimen?
Right now, I am on pellet treatment, and I started that when I was in Dallas. And of course, then when we moved, I hadn't had them in a while. And I'm going to tell you, I noticed the difference, and I looked you guys up because I'm like, I need to find someone that does pellet therapy. And I was so happy to find you. So I've gotten back on pellets. So I'm on testosterone and estrogen. as well as a progesterone tablet at bedtime. And I'm telling you, I think my husband would pay you to not ever let me get off of it because I'm a different, the energy level, it's not just the woman part, but the energy level and the focus and all of those things that I didn't even realize were not there. I realized I had it back. When I got it back, I'm like, wow, I didn't realize I was feeling that bad.
Yeah, it's a fantastic change. And a lot of people will get to feeling better after that first 1 or 2 pellet procedures and think, I don't need this anymore. And then it takes them going back to baseline to really understand what they're missing again, because there's I feel great. So your husband, we got to meet as well. And what drove him into the office was him wanting to keep up with you, or what?
Maybe. Well, when I had actually suggested, I ran a men's health clinic when I lived in Rogers, and I had brought him and said, let's do your blood work, just for kicks and grins. He wasn't having he's never had the first health problem, but it was interesting when we did all of his labs to see that his testosterone level was low. And he's like, well, I wouldn't have ever believed that. And I said, no. So we started him. Of course, back then it was injectable, and he started feeling so much better, and he started losing weight and, realizing that he had more energy there. Well, that clinic, we moved to Dallas, and I started teaching with a very good friend of mine who's a nurse midwife who owns a clinic in Allen. And she said, oh, I do pellet insertion. And
you want to give her a shout out?
Absolutely. Dr. Amy Giles, and she is just amazing. She's in Allen, Texas. She owns the Allen Birthing Center, and they do pellet treatment in her office. And she's one of my dear friends, and I just love her to pieces. But I was a little bit familiar with the pellets because I had worked in a clinic in Rogers or in Bentonville where they did pellet insertion, but I never did get trained to do it. So I had a little bit of knowledge, and I knew people kept coming back regularly wanting those pellets. And I thought, that's just the darndest thing. And, but I didn't feel like I needed anything like that at the time. But like I said, when I got here, after I had been off of them for a few months and then moved here, it was like, you were the first person I was looking for. I'm like, who does pellets? Who does pellets? So,
right.
So yeah. And with John, he was like, well, I want to do them again because I had gotten him to go to Amy's clinic also because we knew his testosterone was low. And so once he got on the pellets himself, he's like, oh my gosh, within a week, he was feeling like a different man.
Good. So what benefits specifically did you notice the first time you got pellets?
First of all, my energy and my focus. I think that was those were the first changes that I really observed, were my ability to focus and to get things done. I'm a morning person anyway, but I was like a real morning person. I noticed I was starting to sleep better and not have like weird dreams, because I have like really vivid dreams. So my sleep corrected. It's like when I wake up at 3 a.m, I don't tend to lay there and think of all the things I need to do tomorrow. It's more like I'm able to learn to take some deep breaths and to coach myself back into my sleep cycle, which is different for me.
Yeah.
Also noticed a difference in how I felt sexually. That's one of the big things right there. I don't know if men ever really fully lose it, but women do. Women, if you don't have any hormones in your body, you just couldn't care less about any kind of relationship.
Yeah.
That has been rekindled. I'm in my 60s. So, there's hope for women. I'm telling you, there's hope for women of all ages. To get that back, because that's the fun part of life and of sharing life with someone that you love.
So were you surprised that testosterone was such a big piece of pellet therapy?
Yes. I knew that women made testosterone. I know that we make it from the ovaries, but probably small amounts. And if that's gone, that is such a critical component to go along with estrogen. That, you do have, there are things I know women are like, oh, I don't want my voice to get deep. Well, my voice isn't deep. I don't want to grow a beard. I don't want to, I don't want this or that. It's not, you don't get enough of the testosterone to really have a lot of those. You may have some little little side effects like acne or maybe a little bit of facial hair or things here and there. But to me, the side effects, the benefits far outweigh the side effects.
Yeah. And, when we're young and healthy females in, let's say, 20s, we are making 10 times more testosterone than we are estrogen. Men make 100 times more. So all we are doing is giving you back the dose you had when you were young and youthful. So now you did mention, besides your butt cheek being a little sore because that's where the pellets are implanted, how long did you feel? So walk us through the procedure a little bit.
Well, shout out to Honey Hull, who's my hormone pellet inserter, and she's fantastic. She's so gentle and she's so kind and funny. I didn't feel anything, when the pellets were inserted at all. But, when the lidocaine wears off, you feel a little bit of soreness. It didn't last but about a week for me. I mean, yeah, and it's only if I bumped myself or, sat down too hard or anything like that. It's not anything that's like excruciating pain.
Right.
Wasn't uncomfortable at all, like to sit down, except for, that first little bit, because you got a big gauze bandage on too. And I think the tape and the gauze are probably worse than, the pellets themselves.
Yeah.
Yeah. Once that's over with and the little incision is healed back up, nothing to it.
Nothing to it. And you're good to go for about 3 or 4 months.
Right.
So in your own words, how hormone therapy has changed your life in general?
Well, it's made me feel like I'm not 63 years old, for starters.
That's a mouthful right there. It truly is.
Yeah, it's made me feel more like I'm back in my 40s, maybe, which I thought 40s was a good era for me. But I feel more like I'm about 20 years younger, and my body feels like it's about 20 years younger. I'm having more ability to go do things like Pilates and yoga and exercise. And I do want to get up and go for walks. And you can't see it because my screen's blurred out, but I have this thing I call the Beast over here behind me, which is an elliptical. And it's like, I feel like getting on that.
Yeah.
Even if it's for 10 minutes just to get up from the desk and move during the day. But it's put me back into a place where I feel normal.
Yeah. And I see where you feel like you feel more patient and kind.
I feel more patient and kind. Not that I wasn't patient and kind, but I feel like I'm even more patient and kind.
Yeah.
I don't feel like I get as edgy as I maybe did about things or stress out. I'm like, I've turned into like lower stress, which is good. Sometimes you have anxiety.
Yeah.
For no apparent reason. And I think that has something to do with hormone depletion. The waking up in the middle of the night and, oh my gosh, what am I supposed to be? I'm supposed to do something. I can't remember what it is. I need to make a note in my phone. And then you pick up your phone and now the light hits your eyes and then stimulates your brain. It's a terrible cycle.
Right. Just a cascade of events.
It is. Yeah. So I haven't been doing that. I've been just learning. I've just, I'm chilling. I'm chill.
Chill. Yeah. And I've seen your motorcycle get up too. So you are very cool and chill. The thing I was going to mention, as females, we're trained to exude patience and kindness. And sometimes we have to fake it until, if our hormones are not balanced, we're truly, it's a lot of effort to fake it. Pellets or hormones in general just give you a buffer, I think, for managing our stress in our world. So you are definitely, Debbie, a hormone hero. What would you like our audience to know?
Well, I think the biggest thing is if you're afraid of it, I feel like it's beneficial to come in and at least get tested. It's not going to hurt you to at least get your labs run and just see. I mean, you may not realize that that's something that's going on in your body or not going on in your body. And there are so many different options, but for me, the pellets are top. I mean, I've tried topical. I've tried other things that just did not work. And I feel like, because you keep the pellets in your system, you're going to absorb it better. And I'll just say, don't be afraid of it. If it's not for you, you don't have to do it again. But I think once you try it, because I didn't know how it was going to affect me when I did it. And I was a little bit scared and skeptical. I thought this isn't going to work. But once I've done it, it's like, I don't know how I can ever live without it.
Yeah. Yeah. That's so true. So we, in our clinic here at Restoration Healthcare, Debbie is doing some consulting for us in the world of health and wellness coaching. Give us a little more detail, Debbie, about what a visit with you might look like.
Okay. Well, with health and wellness coaching, it's everything we did not learn in nursing school about nutrition, about caring for the whole person. And so for an initial visit is going to take somewhere around an hour to an hour and a half. And it's going to depend on, where you are in life and what you want to do. So we'll set what's called SMART goals, and we'll work on some SMART goals and see what it is that you want to achieve. If it's weight loss, if it's better nutrition, if it's to stop smoking, it could be any number of things that's for that client. It's going to be client tailored. And the client actually leads what they're doing. And I'm going to support that client through motivational interviewing and through support of their goals and positive reinforcement, and have them come back. Again, they're going to be the ones who call the shots. Do they want to come back weekly, or do they want to come back every other week, or what works best for them? And then we'll meet for 45 or 50 minutes at each successive visit and find out kind of how they're doing on their goals. I'm going to be their cheerleader. I'm going to be their sidelines person, and everything is positive. We don't judge. We don't prescribe like how they're going to do things. We let the client be the driver of that car, so to speak, and tell us how they want to proceed.
I was just going to follow up with what you said on so many people are now relying on the GLP-1 medications, semaglutide, Ozempic, Wegovy, Mounjaro, tirzepatide, all those things. And I think what the missing piece is exactly what you are offering, Debbie. It will, you're there to help them make a life change and make it an educational process and a habit forming process and things like that. And if you need to use some of the GLP-1 medications as a tool for a while, that's fine. But the value that you bring with your expertise, anyone that would take on a consultation with you is going to be 100 times more successful in the long run, I would believe.
I think it's important to educate. And I'm also in the process of, I'm in a course right now to become a certified holistic nutritionist. And so that's actually go on top of what I've started. I'm about 30%, into the course right now. But that, and then I'm going to also get a certificate in gut health. So all those things, when we realize how the gut and the brain work together, it's such a cool thing to unlock that knowledge, but to be able to educate people who are on GLP-1s and any of those, any kind of weight loss medications, because, you can't just rely on the weight loss medication to do its thing and not help it. You have to
right.
it too. Sometimes it does take somebody who would be like in my position to help coach them on things. Let's look at what you ate this last week. Tell me how you did. Maybe you ate chocolate cake. Maybe you went to a graduation party and, you feel like you blew it. Did it really hurt you to do that? No, just, you'll get back on track. But I'm going to be that person that helps them realize that's normal. It's okay did it taste good? Did you enjoy it? It's not going to be I can't believe you ate that pizza and chocolate cake. It's going to be did you enjoy it? Because you're going to teach them also when they do eat to enjoy their food and not just eat, eat
be
fast.
mindful.
Like rip open a bag of chips and scarf them all down because you're starving. Chew those chips up and taste them. Really, if you're going to eat the chips, enjoy the chips.
That's right. So can you give us just a overview of what the holistic nutrition course certification is teaching you?
It teaches about metabolism and how the metabolism works and all the different, it gets into some pretty heavy chemistry and pathophysiology, which I enjoy. But also I'm getting ready to get into the part about the different nutrients and different food groups. So, it really focuses heavily on macronutrients and micronutrients. So you learn how the carbohydrates, the fats, and the proteins really work at the cellular level. I just love all this. This is like going back to microbiology. And we get pretty intense on things like the Krebs cycle and ATP and how everything works at the cellular level. And I just think that's so fascinating because our bodies are such intricate machines.
Yeah.
And it fascinates me how the body works.
Yeah.
It just gets very deep into all of that. So it'll help me be a better educator for those purposes.
Well, Restoration Healthcare is a very lucky clinic to have you and your expertise joining us and expanding our horizons is definitely into the holistic nutritional world as well. Well, in closing, Debbie, I just want to thank you for coming on, taking the time out of your busy day. I know you've got meetings back to back, and you're running Baylor University from your desk.
From a computer, from a laptop.
Yeah.
Well, thank you for having me. This has been such a treat, and I look forward to being a part of a restoration healthcare and seeing where this takes us in the future. I'm ready to help people.
Yeah.
I've had to have help too. So it's kind of like I understand it from my own perspective and I want to help others.
Fabulous. Thanks, Debbie.
Thank you.
Thanks for listening to Hormone Heroes. Take a moment to subscribe wherever you listen to podcasts so you don't miss the next episode. While you are there, help us spread the word by leaving a rating and a review. If you would like to share your bioidentical hormone story or need help finding a physician in your area, please email us at drkelly@hormoneheroes.org. That's DRKELLY at HORMONEHEROES.org. We want you to be a hormone hero.